just for the sake of recording and posterity, no radioactive material was lost. and,
Well, I was gonna say,
and
it sounds like this is actually the opening to the next Avengers
right,
movie,
right,
right? When they
right,
fuse together,
right.
now you've got radioactive deer. Welcome to Quality Matters, where we speak with experts across industries to see how their perspectives can inform our pursuit of high quality education for all students. I'm Shaka, and this is Caitlin, and we're happy to be your guides for this limited series.
Like you, Shaka and I are passionate about all students having access to a great education, and quality is a driving force behind our work. But what does quality really mean? In an era where parents can customize their child's education, this question is more important than ever.
During each session, we'll hear from leaders in education, technology, business, sports, and the arts. We hope to apply their insights to our pursuit of a great education in the K-12 space.
Join us on this journey to secure a great education for all children. This is Quality Matters.
Well, we are so excited to have my friend Kody Kinsley joining us on the Quality Matters show today. Kody is the former Secretary of Health for the state of North Carolina. He brings experience from both the Trump and Obama administrations working in healthcare at the federal level. He's now advising a number of healthcare companies and is even an adjunct professor at the University of North Carolina at Chapel Hill. Kody, thanks so much for being with us.
Rocket, great to be here. Great to join you all. Thank you.
Well, we're really excited to learn from some of your experiences and see how the things that you've learned and experienced transpose over into the K-12 education space. And, I want to start out thinking about your time as the Secretary of Health for the state of North Carolina. I mean, you led this team and really a system that spans public health, behavioral health, human services, just a range of things. When you talk about and think about delivering quality outcomes for the residents of North Carolina, how do you define that? Again, such a wide application of services and healthcare outcomes. How do you think about quality in that context?
Yeah, something that I loved about being the Secretary of Health and Human Services in North Carolina is that, you know, in the morning we were flying planes over parts of the state, dropping pills to prevent rabies in the deer population. In the afternoon, we were, responsible for every autopsy that happens in the state. And in the evening, sometimes there would be a shipment of radioactive material that was moving through the state that was temporarily not tracked, and we'd have to spin up a number of efforts to find that, and then and you have a hurricane response too, and so the breadth and the dimension of what you're doing is just massive, right? 18,000 people, 33 operating divisions and offices. Um, and all of which, though, comes together at the highest level of trying to support the health and well being of the state. Now, your question of how do you kind of superimpose quality on that? Oh my gosh, like so hard. Like for a lot of this stuff, like we don't even know what quality means. And
Mm.
I'm sure we'll start to like dive into some aspects of this question, right? We think more about performance measures and cost efficiency and we know that the access to healthy food promotes health and well-being, but we know that it is so far upstream that the actual moment when it means the most vis-a-vis chronic disease prevalence around diabetes or heart disease way down the road in the lifespan, but trying to like tie that causal effect so tightly is really hard. So I think that you know part of what we try to do is understand where we have evidence, we lean in those directions, and also we try to orchestrate as much of this together to be cost effective and efficient as well, and quality as a concept is easier thought of with some of these very specific domains, but when it all plays together it can get really really challenging.
Yeah, this is great. I can tell, Caitlin, I see your wheel spinning already. We're just going to have a great conversation here because there are so many different domains. And even as you were speaking, Kody, I was reminded that you were Secretary of Health and kind of in at least the Department of health there in North Carolina during COVID. You had natural disasters strike, whether that was both hurricanes and flooding, just a range of different sort of emergency responses, but some of that stuff drags on for a long time. I'm really looking forward to this conversation. Caitlin, you want to jump in?
Yeah, as you were talking, about what the day looked like, dropping pellets, radioactive material. I mean, there's so much and 18,000 people. In a lot of our conversations, one of the sort of leading trends of thought that allow people to achieve quality or pursue high quality environments in their lines of work is this idea of being like mission oriented, like really focused on this is the goal, this is where we're heading. And when you talk about an environment like the one you were working in, and I'm sure many of the others you've had experience in, when they're that big and they're that all encompassing, are there any like, specific strategies you employ or, ways of going about maintaining that like laser focused, mission oriented, goal driven work?
Sure, sure. So two thoughts on this. One, I think the thing that I miss the most after like the diversity of the work and the variability of the work in a given day is working with a mission driven team.
Mhm.
You know, I really enjoy building teams, building groups of people that see the world differently than I do, putting them around a problem
Mhm.
and, coming after it with your own context and your own background and trying to solve that problem.
Yeah.
And creating the, I mean, I do believe that the highest functioning teams are greater than the sum of their parts. And when you as a leader can create a really safe space, it's kind of an overused phrase, but a space where people can lean into risk, to say the bold thing, to really push back at historical presumption. You can really find your way to some pretty cool interventions. And where we're not talking about arithmetic, but we're talking about calculus, right? How do
Yeah.
we do the thing that is the upstream investment to save money overall, and then some magic financing thing happens and we can reinvest and it all works out, right? And so those sorts of problems are really fun. And I think that, if we're thinking about getting our biggest bang for the buck or the best possible outcome, that type of dynamism in a team and that type of problem solving is an expectation. Now, that is a bit in tension in this context of like big mission, big organization, big set of mandates, and probably my number one job as a leader of this organization, which was to relentlessly prioritize.
Mhm.
Like, part of being a leader in one of these institutions is that, I'm not going to do everything. I'm not going to fix everything, right? This institution was here long before I got here. I hope it'll be gone long after I'm gone. My job is to make a mark in the period of time that I have it and pass the baton.
Yeah.
And I tell people who are going into these roles, and I coach people in the roles now, that the hardest thing that you will do is not saying yes, it's saying no.
Mm.
Like, and being ruthless about, and it's not because, you know, I went to the dentist this morning, so I'll pick on the dentist. This isn't true, but it's not because dental care isn't a priority to me, but it can't be my priority right now because there's an opportunity cost if I want to also focus on behavioral health.
Mm, mhm.
And how as a leader can I, that helps me focus my team, that helps them keep them glued in on that mission, helps them bring their talents to that. And then the other part of my job as their leader is to provide them cover externally to the public who may demand, right? There's always 11.6 million people in a state. Everybody has a priority, and it's
Yeah.
often not mine. And so I think that's maybe the through line here is how do you balance the capability of your team but still provide prioritization, and that's what gets you at that focus.
That's so, so interesting. There were so many nuggets in there that I would love to highlight, but just really quickly, the focus and sort of what you were saying, which is that you had a diverse team. Like, you in what you just shared, you really seemed to celebrate, like, the diverse thinking ways, the diverse perspectives people have, and sometimes I think people are scared to have a team with a bunch of different parts, and the idea is like, well, then how do you orchestrate and manage all of that? And no doubt it's a challenging task, but there is so much strength in having lots of different perspectives, and I really appreciated that that was something that you, highlighted in your explanation, in addition to relentless prioritization. Like, how I just imagine what a school would look like if that was sort of, what everybody was just harping on. Like, what are we constantly trying to prioritize? What needs to be that? And to your point, you're going to have a lot of different people with a lot of different thinking about what needs to be prioritized. 'Cause I
Well,
don't know what
even
to
just thinking about it, in the first sort of examples that you gave, if you ask me, I mean, it sounds good, prioritize, but if you said, "Hey, time is limited," because that's kind of how time works. You can't be in 2 places at the same time, and you've got some radioactive material that's missing.
say.
Also, we've got a bunch of rabid deer in the western part of the state. Which one do you pursue? I actually I have no idea. I don't even know how to start making
I'm gonna
that
send
evaluation.
Shaka to deal with the deer.
Yeah.
Yeah. And first off, just for the sake of recording and posterity, no radioactive material was lost, and
Well, I was
and,
gonna say
and it was
it
not.
sounds like this
It
is
was
actually the opening to the next Avengers
right,
movie,
right,
right? When they fuse together,
right,
now you've
right.
got radioactive deer. Yeah.
Um, yeah, exactly. Right, and some of that, how you prioritize it. Some of it is these are jobs that are responsive to the public, and so in a time like COVID, or in a time like the public makes clear what the demand is. In a time like responding to Hurricane Helene, everything else waits.
Mm,
I mean, you are on the plane every morning headed to the West. You don't stay in the West because you don't use a hotel room because everybody else needs it, but you are up there in every county on the ground delivering food and, asking people what they need and delivering those problems every day. And your effort to promote better integrated care at a FQHC, not your goal that day,
mm,
right? And so sometimes the situations, those are actually the easiest times to prioritize. The hardest times are, not in emergency times when it takes more of the discipline. It's like the difference between, gaining weight and losing weight are always easier than maintaining weight.
mm,
And like trying to like actually
Yeah, well put.
navigate through that is it's a challenge. But that's where I think as leaders you have to have kind of principled, and you have to have a framework or a theory, right? Like our belief in North Carolina was that we spend a lot of money on healthcare delivery, that we have a lot of levers at the department to improve healthcare, and that we are buying more healthcare services and we should be buying greater health. We also believe that earlier investment in prevention, whether it's healthy food or transportation or access to integrated care like mental health services, would lower the cost of care over time by reducing the demand for costly disease care, chronic care. And it's what guided me to make decisions like I was going to cover weight loss drugs, even though a lot of public insurers weren't covering it, because I ended up covering those people when they went into nursing homes 30, 40, 50 years later,
mm,
Right.
and I wanted to lower my costs over their lifespan, not just in the window.
mm.
And so, you have to have those principles that help you prioritize through those decisions.
Yeah, super interesting. When you think about, um, say, not just the maintenance of, the programs that maybe were started before you were in the position, or maybe even they get up and running. But when you're not thinking about maintenance and you're thinking more about modernization, innovation, what does that look like as the leader of this massive, sort of state system, which is sometimes a nice way of saying state bureaucracy, right? I mean, state agencies, respectfully, are not known necessarily for being nimble. I mean, this is a really, really big ship. So, how did you think about, innovation in that space, and whether it's kind of at the practice level or programmatically?
Yeah, I think that the underbelly of that question, I think maybe two parts. One is, um, you know, infusing a sense of relentless prioritization, focus, building a infrastructure around that. Like, we're going to have a new leader. Like, I set three priorities of the department, and hired three individual leaders, and their job was exclusively to run those cross-cutting priorities. We built meeting infrastructures around bringing those cross-cutting teams to get together with those leaders to drive those processes forward. We had, data driven outcomes and metrics that tied to it. So kind of using every tool you have to kind of grab and bring that work forward and to break through. We also, you know, think about human behavior here, right? People want to get in front of the secretary. They care about their thing. Well, all of a sudden they learned pretty quickly that if they wanted a meeting with me about their thing, they had to figure out however it threaded into the priority that I cared about, right? And then
Mhm.
all of a sudden, everything that you want in the department that may be legacy seems to have a hook
Mm, mm,
into behavioral health, right?
right,
Because
right.
we think about it that way, right? So you've got like a school food initiative that all of a sudden has FaceTime with kids and is providing mental health stuff. Oh, and all of a sudden starts to thread in. And so, that's how I think you start to infuse change and change management into those things. But the other piece of the puzzle, just as far as like breaking through barriers with the public about a perception of bureaucracy, is it's about trust building, right? It's about telling the public, I'm going to do this, let me show you how it will be done, and then actually delivering it. And you can build trust over time. And I think so much of where government can do better, and where I believe we did better, was we did extensive amounts of public engagement
Mm.
and extensive amounts of level setting about what we could or could not do, and then tried to tell that story. But we did mental health town halls all across the state. My greatest experience was getting their ideas about what they thought should happen in the mental health system, and then using those meetings to build the political will and to get the financing to actually do the change, and then bring them back the thing they asked for, right? That's
But you've
how
gotta
you
do it, yeah. So there's a
that's right.
performance
That's
element to the feedback, closing that feedback loop. Yeah,
that's right.
makes a lot of sense.
So I'm curious, I loved this idea of trust building. I'm imagining at some points there were things that didn't go as planned or that started
No,
out.
everything was fine. It all went great.
Yeah, right.
Write it
Everything worked
down.
perfectly. And when you're in a public position and trust is critical to achievement and you're sort of being monitored, so to speak, by all these people who are watching what you do because they are affected by the decisions and the outcomes. What did it look like? What did you do when things didn't go to plan or when they went to plan and the plan just didn't result in the outcome you wanted or expected? What did that look like?
I mean, so a couple, one, whenever you're doing like a big rollout or a big change or a big launch, something's always gonna break, right? One way to kind of get ahead of that and build confidence is by, predicting what will break
Okay.
or what challenges will come out of that, and then picking up the phone and telling people in advance, like, you're likely to hear this, or
Oh.
this may be a problem. Like, we're rolling out a new tech system, someone may have a login issue, this is how it will
Mm,
play out, right? By inoculating to the problem, you manage through the change. It also emphasizes that you know what you're doing, you know how to
mm,
be an operator, you know how to manage through that, and you kind of build trust over time in how well those things go. But yeah, things will just go wrong, either because you made the wrong gambit on a thing, or because something else broke. And I actually find those moments when you pick up the phone or you sit down and say, like, look, this did not go how I wanted it to go. It broke.
mhm,
This is what I'm going to do different. And I'm going to take responsibility, and this is how we're going to fix it.
mhm.
Those can be your most powerful moments to build trust, especially with your most critical stakeholders,
Yeah,
than any other time, right? Brushing that over, trying to hide that, trying to pretend like everything is perfect, like that's not, as you reacted when I made the joke, like it doesn't pass the sniff test. And yet too often I think a lot of our public leaders are scared of owning that things can go wrong.
totally.
The last thing I'll say on this, and it ties a little back into your point about difference and different perspectives, is, I have valued that in the political and policy making arena in addition to being in a team, right? Like,
Mm.
I've had the great luxury of being a political appointee in both major parties, Democrat and Republican. I've served in a very swingy state as a Democrat appointee confirmed by a Republican supermajority Senate. And working across those areas of difference also opens up a window where when you are wrong, you can say, I saw it this way, you saw it different, you were right this time. And there's a sense of like shared collaboration that can come out of that.
Too bad we don't have more of that. Exactly what you just talked about, like, "I was wrong, this didn't work," whatever the acknowledgement is, and what I learned is that now we have to do it this way, and I need new perspectives to sort of inform how I'm gonna do it differently. Um, it just makes me think of all the failing schools who are just clinging to this idea or this repetitive, narrative where they're just saying like, no, it's fine, if we just had more money then we could do it this way, or if I just had more money then it would be better. And sometimes I feel personally that there needs to be a little bit more of this, like, it's not working and it didn't work, and now we're going to do it differently, or now I'm going to bring other people into the conversation, or now I'm going to have a different conversation.
Well,
um
Yeah.
it's really hard, right? I mean, the analog here at the healthcare system, right?
yeah.
We have had it's now started to rebound a bit, but we were having, uh, declining life expectancy rates, increased chronic disease rates, and we've put more money into this health system than we could possibly imagine. I think the thing that is like the worm in my brain har, har, for right now that I am like stuck on that I cannot get out of is I grew up in North Carolina without health insurance. I remember watching my mother navigate a health system that was incredibly hard, that looked like pediatrician on a sliding scale, pharmaceutical samples out of a supply closet, a
Mhm.
lot of anxiety, and a lot of tortured hopes and prayers that I wouldn't get sick. Fast forward 40 years, we've expanded Medicaid, we've increased access rates, we've increased cancer cure rates, we've pumped trillions of dollars into the health system. And I think about a mother today would navigate a healthcare system even harder,
Mm,
even more complicated, even more vertically integrated, and even more stressful, with even more risk of debt and even more risk of poor outcomes. And yeah, we put a lot of money in it, and so I understand where it's hard for people to envision what is the big jump forward to something that is very different. And I think that is a big analog between the education system and the healthcare system right
for
now.
sure.
Yeah, and that's you've given us a lot to think about there, and I'm sure that our listeners, our audience, will kind of ruminate on that for a while. What's changed, maybe what hasn't. Is there an example that you can think of, something that maybe you saw prior to being even in the role of secretary, but something that you saw that you just went, boy, this practice or policy seems really outdated, and that you moved away from during your tenure, maybe because the data didn't support it, maybe because the community's needs demanded a change. Is there something kind of that comes to mind, a specific example that you could give us as something that you just went, yeah, it was time for a change in this area, and here's what we did?
I mean, gosh, I think I'll give you the clean answer, and then I think of a couple others that I think are a little bit more nuanced. So one is I believe we have been in the healthcare system experimenting with this concept of patient responsibility for some time, right? We believe that if you have more individual skin in the game, that will help us control cost. And I think that over the last 20 years, um, we've not seen it markedly move utilization down in a meaningful way. We've just seen it balloon medical debt.
Hmm.
The structure of insurers and providers and the way they put more and more patient responsibility in the form of deductibles and copays and all these other things just squeeze people in between these two systems in a way that is incredibly hard and gives them really poor emotional experiences at some of the most traumatic times of their lives.
Mm.
And I think that, I don't think I've gotten the entire country to agree with me yet, but I would like for them to all agree with me that that was dumb and let's throw it away. We started to do that in North Carolina with our medical debt relief effort, essentially saying that we were going to dramatically change the standards of any total patient responsibility that can be shifted onto patients,
Hmm.
and tried to put that as a stopgap to put more tension between the payer and the provider in their negotiations without allowing as much spillover onto the patient. Now, I think it's to be seen if that's still the right strategy as far as those market dynamics. But I think we need to say that patient responsibility purely is not the right piece of the puzzle in the healthcare frame. I think there are a lot of these sorts of questions,
Mhm. Mhm.
whether it's what does care and support look like in the disability community? There's a big fight over institutional versus community based care and meeting everybody where they are and what that looks like. There's big conversations around what does aging look like in our society. Are people in institutional levels of care or at the in homes, in homes with individuals? How do we navigate that? And I think I'll loop this all back to this broader question of quality in this moment. How do you say which one is more quality?
Mm. Yeah.
Right.
Yeah.
And I
Yeah.
think that those are the challenges that we face, because in the end, it's not just about, I think, quality, but it's about what we value, and those values are different, and how we find our way to a system that kind of meets people where they are collectively.
Yeah. Thanks, Cody. It also occurs to me that in this context, we're speaking about healthcare now, but Caitlin and I have had some conversations with other guests about the criminal justice system. And then certainly in what we know best in education, um, we're also dealing with these interventions in real time, but sometimes we don't know how they're going to go for a number of years, right?
Right.
And the healthcare system is certainly like that, right? What is changing the pay structure? What does that do to how people seek care? Well, we might not know, right? Because there's such a lag there.
That's right, and that's the problem with the getting way upstream. And look, this is how we learn in the policymaking environment. It's also the benefit of having, you know 50 states and 6 territories, and why I think there's a lot of opportunity for looking at what's working and not working in other places and trying to replicate within the context that you can.
So I would love to sort of flip Shaka's last question, inverse it. You talked about sort of, experiences you've had, policies that you've sort of moved away from, practices you've moved away from. If you were given the wand and you could wave it and you could give one, this is what I think should be happening in education, or this is one way I imagine, outcomes to improve or quality to improve, um, based off of either your own educational experiences or a lot of your work and sort of what your most recent involvements have shown you, what are you waving the wand to make happen?
It's really hard to ask someone who's spent their entire life thinking about like big systemic policy stuff to focus in on one. So this is a gotcha question. um this is deeply rooted in my personal experience. I mean, education was an amazing jumpstart for me in my life, right? I
Sure.
was the
Mhm.
first in my family to go to college, and then on to graduate school. I saw how those experiences and the cohorts I was part of opened doors and gave me opportunities to kind of lift me up and lift me forward. And at the same time, I've worked in places where there was a presupposition that if you went to only particular schools, that meant you were the smartest. Like, I've
Hmm.
seen the elitism aspect
Yeah.
of that play out. And so I guess if I had a magic wand, it would be that people could um do well economically, could support their families and live, and not have to go to only a handful of schools.
Hmm.
And that the continued growth and support of community college systems and technical trades, and
Yeah.
having an economy that rewards work as much as it rewards wealth, and the way in which education plays into that, I think is really really important. And I think right now we're seeing a lot of the kind of divide between, you know, quote unquote educated elite and technocratic people, between folks that see a lot of honor and value in working with their hands every day. And I think education, we have been heavily invested in this kind of meritocratic frame where education is the only path forward. And I think we have to talk about the value of education, and we also have to make sure that there are many different paths in which people can do well and support their family and live a life of meaning and purpose, and to have the American dream.
I think
So
that's
there, I give you a really big wand answer. I'm sorry.
I love it. I love it because you know what our next podcast episode is gonna be on? It's the quality of life. What does life look like to make it high quality? Because what you're describing is really, and we've had these conversations in some of our other interviews, but like what constitutes these high quality educations, and is it just the name on the diploma? We all know that that's not the case, but yet sometimes we find ourselves in situations where that's really highly emphasized, almost like it is the case. So I think that there was a lot in your answer that I imagine so many people listening will have a lot to think about and different takes on, and a good response to. So thank you
Yeah.
so much for the
Yeah, it makes
conversation.
me think of sort of the conversation we had with Mike McShane
Mm,
last season, Caitlin, about the sort of concept of eudaimonia, the good life, right?
yes,
I mean, this is kind of what we're pursuing. I think education does that. I think health systems are trying to help people pursue that as well. What does the good
totally.
life look like? Kody Kinsley, thank you so much for joining us on Quality Matters. This has been a great conversation. And of course, we can't get into nearly as much as we would like in this short amount of time, but we really appreciate your time and thank you for your service.
For Caitlin, it's been an honor. Great to spend the time with you.
So much. All right, Shaka, another really interesting conversation with someone who sits
Yeah.
outside of education, and yet so much of what Kody Kinsley was talking about is going to inform the way the education system looks and works, and hopefully the way a lot of people practice within the education system. Um, I loved, his intro story, sort of sharing a little bit about what, the day looked like. I had no
It
idea
was
that
wild.
so many different elements of the way a state works and operates falls into that realm and into the
Yeah.
health
Department of Health.
world. Yeah,
Yeah.
Department of
Yeah.
Health. That to me was just like, what a great way to really lay the foundation for what his experience has been, what his perspective has been informed by. I loved that.
Yeah. I agree. Just what a wild ways to spend your time, going from, as he mentioned, the western part of the state, and you're dealing with animal health issues. It could spread to people, to, other material stuff. I mean, just really, really wild. And again, for our listeners, and hopefully you go back and you listen to the first part of this episode with Kody. Um, he was Secretary of Health during some really tumultuous times in
Yes.
North Carolina.
Yep.
I mean, COVID, obviously, we don't even really have to say anything about that. I mean, there's that was so disruptive and devastating to families and communities. And then Hurricane Helene, when it came through, just wrecked the western part of the state of North Carolina and kind of some of that Appalachian area. And yeah, people sort of maybe forget, or if you've never been in that situation, a hurricane comes through and the power goes out. Well, it's not just rain and electricity. All of a sudden, I mean, like, you lose power in hospitals. This is a major problem. Or people at home who now don't have access to their medical professionals and their care teams. Like, super disruptive. And he managed through all of that. For such an optimistic guy, I thought it was really interesting that he said one of his major takeaways and advice, it sounds like he would give to others, and I think it works in the education space, is learning the power of no,
I loved that.
saying no. Yeah. Yeah, that really struck me. I wrote that down. Kind of he said relentless prioritization.
Yeah, you know what it made me think of? My dad used to say to us growing up, the hardest thing he has to do is say no to his kids, but it's also the most important thing. And that was like my first sort of aha moment of like, oh, there's a lot of power in being able to in having to say no and knowing that it's the right thing to do because it means that what you're saying yes to is almost that much more emphasized. It's
Yep.
there's that much more conviction behind it. And if you just said yes to everything, but you didn't actually mean it, A, you dilute the power of your yes, and B, you dilute the attention and that you're giving to things and the energy that you're giving to things. So it makes a ton of sense why that's the case in the example that he was talking about and being able to say no because you're laser focused on these priorities, my brain was also going to what happens if people start saying no to schools? Well, that can look really different. You could either say to a school, no, you cannot remain open because you are not doing right by the students you're serving.
Right.
Or a parent might say, no, this school doesn't serve my child the way that they need to. And so I want to go elsewhere. So, like, there's just
Mhm.
so many ways that you can um, analyze what saying no does and the effect of saying no. And for him to be sort of championing and teaching, coaching, advising other people on how to do it in the right way and with conviction because you're trying to focus your yeses in certain directions. I think that's really powerful.
Yeah, I agree, and I thought um, about taking his advice really at the school level even, and thinking about, as a school administrator, you're getting lots of requests from faculty, from families, from students even, sometimes even community members about, "Hey, can your school be a hub and be a resource for all these things?" And it is really, really tempting to say yes to everything.
Mhm.
Yes, we want that we've got this building, we want it to be open for the community to use on weekends and blah, blah, blah. Okay, fine. Um, yes, you want to run a food pantry out of the school. Okay, great. Yes, you want to do healthcare screenings here at the school. These, in and of themselves, like are can all be positive things.
Mm,
But the risk is that you start to say yes to so many things
right.
that they become a distraction from your core business,
Mhm.
which is education. Are you academically proficient? Right? Are you benefiting your students academically? Because if students leave and they've had um, a dental check while at school, I mean, I'm glad for the dental health check,
Mhm.
but if they leave with that and they get out of 4th grade and they can't read, we've still got a major problem.
Yeah, I mean, that's exactly right, and what he said, when he had to put off I think he used the dental analogy. It's not that the dentistry is not important, it's just
Right.
that in this moment, there has to be a different priority that supersedes the focus on that, and so, you know, as he said, in some situations, there's a hurricane. All right, that becomes really easy where the priority needs to lie, where the energy has to go. But when you're just trying to, you know, um,
You're in that maintenance stage. Yeah.
exactly, that's when it gets more
Yeah.
difficult. And I think that what you were just saying about how it applies to schools and that analogy is spot on. I would be curious how someone like Ashley Burner would um, sort of play into this conversation because what is making me think of is her discussion on education pluralism and like how
Mhm.
there's all these different um there's all these different ways of educating, there's all these different mo or forums in which you can learn and all this stuff, and so everybody would say no to different things is essentially what I'm trying to get at. And so if everybody's saying no to different things, um it just makes for a dynamic conversation because what you're ultimately coming back to are what are people's priorities, and when you
Yeah.
everybody has different priorities, you're just existing in education pluralism and all of these different ways of educating, ways of assessing, ways of prioritizing, ways of learning. Just, it continues and it continues, and you can back it up and you can back it up. But at some point, having the conviction to say no to certain things because you're prioritizing other things is what makes a difference. And it is what separates effective leaders, I would say,
Yeah.
from sort of
Yeah.
people that are just pleasers.
Well, so one of the things that he touched on in terms of being an effective leader was communicating transparently when
Mhm.
things are not going well.
I like
Did you
that.
catch that?
Yeah, for
Yeah,
sure.
I thought that was a really important point, sort of the acknowledging faults. And I've been reading some about like startups and startup companies and whatnot. And in the startup world, often um, they view sort of failure and sometimes catastrophic failure of a new business idea, whatever, as really beneficial. They think, oh, well, you got out there, you tried. But I think part of it is because people are like in the startup community go, hey, here's what I tried. We poured this kind of effort into it. Here are the marks we were hoping to hit. Here are the ones we did hit. Here are the places where we fell short.
Mm,
And you're just kind of like open book.
mhm,
And I think that people appreciate that versus, as Cody was saying, if you set the expectation at, well, of course, we're going to get everything right. Well, not only does it not pass the smell test,
right.
but you're going to let people down because almost inevitably, especially with a system as big as a state, but even in a single school, if you're talking about 250 kids, well, you just can't script everything.
Right.
Something is going to go sideways. And so um, I think schools and whether it's at the school level or district leaders, et cetera, would do really well to acknowledge and start being transparent. And I think that over the years, recent years, has led to a lot of mistrust among parents because sort of parents know when they're getting sold a bag of beans
Yep.
and and you say, "Hey, you promised me this." That doesn't one, I don't even think you can deliver. And then, by the way, I'm going to find out in 2 months that you, in fact, could
Mm.
not.
Okay, how about this? Dr. Ken Sands talked about at one point in his conversation this idea of being able to accounting for humanity
Mm,
in the hospitals. And when you make a mistake, being in a position or in an environment, a community where you can acknowledge that you made those mistakes and that we're now going to figure out how to move forward. And if there's something that needs to be corrected, we're going to correct it. If there's a procedure or a procedural systemic adjustment that needs to be made, we're going to do that. That takes a lot of humility. It takes a lot of confidence. It takes a lot of security or needing to be in an environment that's secure. So I feel like what Cody was saying was sort of this same thing, but on a different scale. Like he was sort of acknowledging as the leader of these big systems with all of this responsibility, heading up 18,000, an 18,000 person team. Like you have to be able to say when something doesn't work, and you have to be able to, you know, pivot and readjust. Um, and I'm not sure I had any specific.
Well, it sounds like he was really rewarded for that too, right?
Yeah.
Because it sounds like he was in this environment, and for folks who don't know, North Carolina is a politically sort of divided state, kind of along partisan lines. So you've got at least at the time that we're taping this, you've got a Democratic governor, you've got the Republican supermajority in the assembly, and there's often a lot of friction there. But
Mhm.
he was able to navigate, right? He worked he was appointed even in different administrations by people of different parties. This is not an easy kind of climate to navigate,
Totally.
and he did it. I am really encouraged by that. It makes me think, of course, in our world that like everything else, but definitely in education, things get so politicized, um, in some ways unnecessarily,
Yep.
right? Like because just like I have to imagine if you're in the healthcare situation, a healthcare setting, and you have got a healthcare crisis, um, man, if you need emergency care, nobody stops and asks the paramedic, "Hey, by the way, who did you vote for last election?"
Right.
Right? You're trying to get care.
Right.
That's what the priority is.
Save me.
If you're Yeah, save me. If you're in a dire educational situation or your child is, I don't know that people care a whole lot about, um, hey, did you representative vote this way or that way or whatever, right? You're trying to find a place that works for your child.
Totally.
And I think that the partisanship kind of falls away. I think Cody's example of how you navigate that um, is helpful because one of the things it starts with is just building trust. And how do you do that? One of the ways you do it is with transparency and humility.
100%, which I think the two go hand in hand. You said something that was so interesting and kind of just clicked for me. You said he was rewarded for doing that, for acknowledgement of those mistakes. I'm thinking that his reward, as is the case with everybody when they sort of come forward, they acknowledge, the reality of the situation, perhaps it's positive, perhaps it's negative, um, they're rewarded with trust from other people, whether it's the trust of
Mm,
their school community, the trust of the um, residents in the hospital, the trust of your constituents. Like when you are honest, and a part of being honest is acknowledgement or admittance when something doesn't go as planned. Um, when there's a negative consequence and you own it, there's that accountability, you're owning it, so you're seeing it clearly. That translates into trust. Someone's like,
mm,
okay, they are looking at this situation realistically. They see what didn't work, they see what did work. Okay, well, that's going to build you some trust. But then the next thing that he said, well, then you do something about it. You either switch what you did the first time, you bring in new people. So then you're acknowledging the reality of the situation, and then you're taking an action step towards remedying it or
yeah.
you
And you've got
know
this kind of virtuous cycle. Yeah.
right, and then what you're doing, whether they're Democrats or Republicans, they're trusting you, and they like
Yeah.
how you operate because they know they can believe what you say, and they know that they believe that you're going to address the situation in the realistic way that it's happening. And I think delusion sometimes makes people really uncomfortable because it makes them feel uncertain. Like if someone's, talking about how great a school is and yet the kids aren't able to read on grade level,
Yeah.
you're something doesn't isn't adding up. And if you as the leader aren't seeing what's not adding up, why am I going to trust you to, remedy the situation and lead us to better greener pastures?
Yeah. Yeah. No, I think that's right. It's such a key component of a quality relationship between any institution and the people that it serves, right? Whether it's a business and its clients, but a school and the families and students having that trust. Well, again, it was a great conversation with Cody Kinsley, former Secretary of Health. Really glad that he joined us. You know, a question maybe for our audience. I would love to know on this, thinking about saying no and how you prioritize. I'd love to know, e- especially for folks who are in the education space, but others too, um, including the two dentists who hopefully are still sticking with us if they're part of our audience that we've ostracized. I would like to know what's something that you said no to because you needed to stay focused. What's a thing that you, for whatever reason, had to turn down? Maybe it still would have been some kind of benefit, but just to stay focused, you've had to say no to in your leadership experience. Drop that in the chat. We'd love to know some more of that. And until next time, Caitlin, it's always good to have these conversations.
So fun. This was a great one. I can't wait to see what people have said no to. I can't wait to be inspired by what people have said no to. If they can say no to that, I can say no to this.
Yes, inspiring rejects. Let's hear them.
Yeah.
All right,
All
see
right.
ya.
Bye.